7022. We will respond to you and answer questions that we have. So, or you have. We are absolutely ready to help. That is the reason why it's the helping. Especially us from Africa. Unfortunately, when I was in Ghana, I knew nothing about the medical field.
Okay.
And I graduated. I had my first degree in Ghana, but I knew nothing. And so I know, a lot of people who are listening, especially and watching back home, I'm using the word may.
Okay.
The fact that I didn't know doesn't mean that somebody doesn't know. And even if you know, this gives you an opportunity to add to what you already know. Hopefully you can learn something from us so that, people can understand diseases and can, when they go to their doctors, go to their providers, they can really have a meaningful conversation and then ask pertinent questions that obviously will help them get better. So that's the reason why we're doing this.
Thank you, Dr. Yeboah. I want to talk someone. Sorry about we got a little problem, technical problem for internet, so we start back. And then sorry about people watching us to make sure everything doctor said they can understand. So that's why I will stop you to say you have to tell them exactly the simple word is a symbolized to make them understand. That's what we're talking about. Okay. So today is just introducing for diabetic.
Yeah.
So I know we got 3 main things for diabetic. We're gonna explain for next video.
Yeah.
So you can tell them, but I want to tell someone if you have a question. If you have a question, just leave a comment, and then we can just catch the question and then ask the doctor. It can be respond quickly before you end this video. So, doctor, the people, I talk somebody. When I just walk away, I talk somebody. They told me, I know the doctor say truth about hypertension. They heard, they watching the video, but they said we have a more way to avoid those things, but people scared about, like America. It costs some money. It's a different thing. It can be the billing come very high. So told them something about cost. It's a very important.
It's a very important topic.
Very important.
I've always said it, and I'll continue to say it. If you don't have money, that should not prevent you from coming to see us.
Okay.
Come.
Just
okay?
come.
Just come. Like I said the other day, it will be a very minute, small fee. And if you come in and we're saying, okay, you know what? You're going to pay this small. We're going to ask you to give us a small fee. And even if you say, I can't, afford it, that is not to say that we are not going to see you. Okay, so we don't want money to be an impediment for somebody to see.
The first, money will be the first.
We don't want that to be, an obstacle for you to go and come and see us. If you come to 3333, that is 4 3s, Boston Road, Suite 11, Louisville, Kentucky, 40218. Our doors are open. Weekdays, we are open in the evenings from 4 p.m. to 10 p.m. During the weekends, we are open only on Saturdays from 9 a.m. to 3 p.m. We have what is called urgent care to you. If you cannot come and you live in Louisville, Kentucky, give us a phone call. We will be able to organize a provider, a family nurse practitioner just like myself, and we take care of the entire family, right? We are trained to take care of the adults. We are trained to take care of children. We are trained to take care of the old. All. We take care of all. I'm a family provider. That is what we do. We provide medical help, medical assistance, and we are trained as family nurse practitioners to do that. And that is what we do. So, I know you call me doctor.
Yes.
What I do is And I'm understanding that you're calling me a doctor because I provide the services of what doctors do. But so I'm a family nurse practitioner who provides medical, treatment to patients. When you come there, we take a look at you. If we need to order any test, we do it. If you have to order, we write you scripts, send your medication to a pharmacy, whatever and wherever you want us to send it to.
Okay.
So a lot of people are coming in. We are seeing amazing things. And let me share this with you. Last week, this week that passed, there's a patient who came in there, a lady, an older, older lady. She came in here with her husband, Caucasian. She was having problem breathing. She came in, obviously evaluated her. I realized she needed oxygen. I put an oxygen on her for a couple of minutes. Okay. I did her vital signs. And then I realized that, her blood pressure was elevated, her heart rate was elevated, and then obviously her oxygen was low. That's why I gave her the oxygen. So, after I evaluated her, I listened to her lungs, her heart, did a lot of tests, reflexes, looked at her legs, and I realized that she had some fluid built up in the legs, both legs. And then...
Was it eczema?
No.
By eczema? Okay.
No. And then so many things could do it. Heart disease could do it. Heart failure is a very major common, sign that you see people developing, what is called edema, fluid in the in the legs. So I did that, and I realized that she had that. Her lungs were clear, and I told her we need to go to the ER. She was shocked because I told her most likely she has what is called, a clot, pulmonary embolism. That means she has a clot in her lungs, which can be deadly, can be extremely deadly. So I told her we need to go to the ER, and I'm going to call, a 911. So the husband said, no, I'm going to drive her straight. I called the ER. And we are medical, because we are an urgent care, we have a wonderful, communication and a relationship with the ER. So I called one of the major hospitals here in town, and I was on the phone with the admitting doctor, and I told her, I'm very concerned because it seems like really the patient that I'm sending her way obviously has something, an impending problem actually brewing. So she said, okay, we'll be waiting. So true and behold, they got there. The hospital absolutely called me later on and said, we are lucky we are really grateful that you sent this patient our way because truly she had a blood clot in her lungs. And then also this patient didn't even know, but she had also developed type 2 diabetes. Wow. Her sugar was like 600, which I told you the normal blood sugar for a person is supposed to be 70 to 110. Her
17?
70 to 110. 110. Yes.
Like, let me explain someone.
Okay.
Le docteur sait, notre nurse sait, le minimum de la quantité de sucre que nous devons développer dans notre corps, que ce soit normal, c'est de 70 à 110. De 70 à 110. Donc, si vous voyez déjà, votre sucre est en dehors de ce cadrage de 70 à 110, dites-vous, vous avez soit hausse du sucre, soit baisse du sucre. Doctor, one thing come to my mind to say, we developed like a high blood sugar, but we developed too a low blood sugar.
Okay, you can develop a low blood sugar, but it's not common.
Okay, it's not common.
It's not common.
Okay.
If you develop a low blood sugar, obviously hunger. If you're not eating enough,
okay,
your blood sugar definitely can drop. Now, as you know, I remember we started. I know, when you came in, you've gained weight.
Yes.
I have gained weight.
Exactly.
We all, especially if we came from Africa,
you make like a compare two pictures.
Exactly.
When you came.
Right.
And then from now it can be different.
So
different person,
exactly, two people. So
yes.
What is amazing is that when we eat excess, when we eat a lot, our bodies store the sugar that we don't need in a form of fat. The body will store the excess as fat. Because we hold on to this fat, we gain weight.
Okay.
So normally, even if you are not eating and your body is working well, next week when we discuss, there's something called pancreas. We have the liver, which obviously these organs really work very well in order to control our blood sugar. So now, if you are not eating and your body is working effectively, your liver, remember I told you the excess food that we eat that our body doesn't need it, what does it do to it? It doesn't throw it away. It stores it as fat, right? F-A-T. It stores that excess food, excess sugar into what is called absolutely fat. So when your blood sugar goes down or is going down, what our body does, in this case, working with the liver, is that it changes that fat into sugar.
Okay.
That is the reason why when we go to bed and you sleep for 8 hours, 10 hours, 12 hours, you still wake up. The brain still gets the sugar. You know why? Because your liver, when you were sleeping, you're not eating anything, your liver went to work. It's called, gluconeogenesis, and we don't want to. I don't want to go over that big terminology, but in simple terms, when we don't have or we are not eating, enough food at a certain point, or even if when our body realizes that the blood sugar is going down, our liver goes to work and converts the stored fat into glucose into the bloodstream. Then the glucose will bind to the insulin. Then the insulin will take the glucose to the cells. Does that make sense? So hardly do people develop like low blood sugar. On the other hand, we eat more than our body needs. Therefore, and we gain more weight, and we don't exercise, and then we don't do a lot of things. And as a result, we rather tend to develop high blood sugar more than low blood sugar.
Oh, someone told me, ask a doctor this question. He said, do you have any specialty for you? Just one specialty.
Well, am I a specialist?
Just a specialist for something.
Okay. What I am, I'm trained like a general practitioner.
Okay.
And that's why we take care of the family.
Okay.
I'm not an endocrinologist. I'm not, like I said, I'm not like a doctor specifically who deals with one thing. I'm a family nurse practitioner who deals with everything. So if you come in, we deal with infections. We deal with chronic diseases like diabetes, hypertension. We deal with congestive heart failure if the heart is not doing well. We deal with a lot of things. And if you come in and there's something, just like I told you, that is beyond what we are supposed to treat, we move you up. You know what I'm saying? We absolutely will direct you to the right. If you come in and realize that your visual acuity, your eye is not where it's supposed to be, let's say your vision is 20/60, 20/50, we're not going to sit there. We're going to tell you exactly where to go from there. So we have a wonderful association with all specialists, just like even doctors obviously have, you don't get one doctor. You have general practitioners, doctors who are in general practice. Those are the primary doctors that we call them. Well, he's my primary physician. I'm a family nurse practitioner who is trained, obviously, in overall, we take care of not only kids, but kids, adults, and everybody. So I'm not a specialist, but rather I belong to the general practice group, a family nurse practitioner.
I think my sister has responded.
Okay.
Yeah, she get this response. But I want to talk on another thing for the French, for
Absolutely.
French speaker. Nous sommes en train de parler sur le diabète. Le diabète a au moins 3 étapes ici, comme le docteur vient de le dire. Cette maladie a 3 étapes. Et nous allons décortiquer mot à mot. Aujourd'hui, nous sommes en train d'introduire cette maladie diabétique. Alors, nous allons parler des 3 étapes. Les 3 étapes qui sont les grandes étapes qui constituent cette maladie diabétique. Là, je parle vraiment de la santé. Parce que je disais tantôt, la santé n'a pas de prix. Comme la santé n'a pas de prix, Carib Magazine vous donne toujours cet moyen de vous éduquer par rapport à votre santé. Et il y a beaucoup de nos frères, beaucoup de nos frères qui sont déjà guéris. Ils sont déjà guéris en avant parce qu'ils ont écouté le conseil du docteur et puis ils se sont améliorés, ils ont changé leur mode de vie tout en faisant des exercices, appliquer tout ce que notre nurse Yeboah parlait ici. Alors, nous sommes là pour vous éduquer. C'est pour cela que nous avons appelé les docteurs pour essayer de parler chaque émission, chaque vidéo, parler de quelque chose qui est vraiment topique, qui peut vous aider. Nous allons continuer à parler sur la diabétique jusqu'à ce qu'il va nous dire c'est fini. Mais aujourd'hui, nous avons commencé juste l'introduction. Alors, docteur, I told them today is only introducing for this topic. So, what the main thing they can now about you, from you, to realize it. Okay, today, Dr. Sam Yeboah said, he said about this thing, we catch this, and then we can wait for next video. He can go through to explain more details.
So today, we've obviously introduced to ourselves, what is diabetes and absolutely the signs and symptoms of diabetes.
Okay.
I just want people to pay attention to these signs and symptoms.
Okay.
So somebody can ask, if somebody has diabetes, what may they show? What should they look for?
Okay.
3 P's: polyuria, polyphagia, polydipsia. If you're urinating too many times, especially at night, you go to bed, even if you're going to urinate throughout the night, if you get up one time to urinate, that's perfect.
That's perfect.
2, 3, 4, I'm concerned. That's absolutely a problem. You shouldn't come and see us. Come to New Family Agent Care. Don't go to bed and be waking up almost every 2 hours and urinating. That is not normal.
Even a day.
Even during the day, you're urinating.
What time probably during the day?
If you're urinating every 2 hours, every 3 hours, that's a problem. It tells me that if you're in a plane, you're going to get up almost every 2 hours to urinate. That's not. We've been here since you came here. I haven't seen you. I've been here for a while. No, you shouldn't be urinating every 2 hours. That's too often. Our body is not made up to be urinating every 2 hours. So if you're urinating too frequently and you're always looking for water to drink, you're chasing water, you should drink water. At least, 5, maybe if you drink 4 or 5 of these a day, that's perfect. But like every minute you're looking for water, okay, where is water? Oh, I'm so thirsty. Oh, I'm so thirsty. But
what are you drinking ago?
Like a minute ago, you just drank water. Within a short period of time, you drink, you go and urinate, then you drink, then you go. That is also concerning. And then you're eating and eating and eating, but you don't feel full. Remember, I said the sugar is the energy. The food we eat must be broken down into sugar. The sugar must get to a place, and that place is called the cell. The sugar must bind to the insulin. The insulin is the car that takes the sugar to the cell. If the sugar doesn't get to the cell, even though you just ate, the cell will still be sitting there being hungry, and your brain will perceive that as you need to eat more, you need to eat more, and you continue eating and eating and eating whilst you still feel hungry and hungry and hungry. So if you eat and you're hungry, and you eat and you're hungry, and you eat and you're hungry, that's also a big problem. So these 3 big things is what, if anybody is not going to take anything, I'm hoping you're taking attention to, you're paying attention to these 3 major things. I talked about blurry vision. I talked about poor wound healing. I talked about irritability. There are so many things that we've talked about. But these, big 3, I absolutely want people to pay attention to. Sugar. And then also learn this. I want this to be a teaching and an educational moment. If you're in America, a normal blood sugar, I said it's supposed to be 70 to 110. If you are home and you ever check your blood sugar and it is more than these numbers, we have to investigate more. I'm not saying because your number is more than 110, you have diabetes. It tells us we'll go detail into it.
Something going
we
on.
have something going on. We even have something called pre-diabetes. And we'll go into all that.
Okay.
What is pre-diabetes? Why do we say it's called pre-diabetes? We'll go into all that next week and then even more. That's why I really want us to take our time. Today, we're introducing it. What is diabetes? What are the signs and symptoms of diabetes? Okay. Is there any type of diabetes? And I've made mention of 3. Type 1 diabetes, type 2 diabetes, and then gestational diabetes. And we'll take each one of them and explain it as well. Okay. But the signs and symptoms, regardless of whichever type it is still the same.
Thank you, doctor. Today, thank you so much because you explained today very quickly and then easy to understand, to understand.
Absolutely.
That's very important because some of them, they ask me, we need the doctor say a little bit, the simplified word to make us to understand exactly. That's what he's talking about. That's great, very good today. Thank you, doctor. Thank you for everyone keep watching Caribou Magazine on YouTube et Facebook. Je dis merci à tous ceux qui ont regardé Caribou Magazine sur Facebook et YouTube. Nous avons introduit aujourd'hui notre topic diabète et nous allons continuer la semaine prochaine. Merci à tous ceux qui nous ont regardé. Merci à la technique. Merci à tous le téléspectateurs des internautes. Là, nous sommes là sur Caribou Magazine Santé. Sur votre santé, nous en préoccupons parce que la santé n'a pas de prix, comme je l'ai dit. Merci à toutes les notables de Louisville. J'ai dit merci à Blaise Kimoukedi depuis Louisville. J'ai dit merci à Papa Géry Mabiala, le président de la communauté congolaise depuis Louisville. Merci à Patrick Moutripa qui déjà dans quelques jours, il va totaliser son quarantaine. Comment ça s'est fait? Quarantaine. Toubenga le quarantenaire parce que ça doit se fêter. Merci à toute l'équipe. Merci aussi à tous ceux qui ont suivi depuis Kinshasa. Je vois Keren Lacruz depuis Kinshasa. Vraiment, bon dimanche à toi. Je vois aussi mon ami Christian Malelo, vraiment prophète. Vraiment, bon dimanche à toi. Je vois beaucoup, vous êtes vraiment nombreux. Je ne saurais pas vous citer. Je vois aussi Maman Nisha Mayaba à la maison. Vraiment, écoutez ces conseils, ça va nous aider en famille. Doctor, last time you can talk someone before we handle this video.
So thank you very much. I'm really hoping your audience will definitely listen to what we are discussing. Okay. And then for those who are here in town, don't hesitate. Just come to New Family Agent Care. Just come and see us. Okay. Sit down, discuss with us. You know, we are family. We want people to feel comfortable coming to us. You know, even if you're not sick, and you want to come and see absolutely what we're doing, come to 3333 Bardstown Road, Suite 11, Louisville, Kentucky 40218, and then we're obviously there to definitely support you. You know, if we need to, whatever we need to do, insurance or no insurance, come and see it. Social Security or no Social Security, come and see us. Papers or no papers, come and see us. We care less. We just care about you. We don't want you to be sick at home and absolutely don't know what to do because you don't know where to go. If you don't know where to go, now you know. Now we are coming to you. Even if you want us to come to you as well, just give us a call or go online to www.newfamilyagentcare.com. Go to the services. There's a form there, you know, called Agent Care to you. Fill it out. We will see you. We will see it will come to us. We will evaluate it, and then obviously we'll follow up and call you and follow up and come and see you. So thank you very much, and stay tuned next week. And we apologize for the technical difficulties that has occurred today. We promise, you know, to obviously get it better. And as well, the goal is to come to you around 3:30. You know, and unfortunately we couldn't make it today. So, you know, pardon us for that as well. We promise to definitely do better next time. So thank you very much. Thank you. And thank you, Caribou Magazine as well.
Thank you. Thank you, docteur. Alors, merci. Comme je disais, à la prochaine sur notre nouveau vidéo. Nous avons dit sorry pour le temps. L'émission est toujours 15h30, ça n'a pas changé l'heure. Pour ceux qui m'ont écrit, l'émission n'a pas changé l'heure. C'est 15h30 à 16h15. Donc, il y a 45 minutes d'émission. Mais aujourd'hui, nous avons commencé un peu un petit retard suite au problème un peu technique. Et puis, nous avons eu un problème technique encore au milieu de l'émission. Il y a eu un problème de l'Internet. Alors, ne nous tenez pas rigueur. Merci, nous avons fait de sorte que pour vous donner toujours cette nourriture en temps voulu, comme on l'a dit